And hello to everybody. I am so excited to be doing this live. So excited to be doing this live tonight with Dr. Ratzistorper and the team from Maternal Resources. So excited that we get to ask the OB pretty much anything. And I know that the questions have been coming in, and they've been coming in with really, really important questions that I think we need to explore. And people keep asking me, like, I don't understand, why can't people ask their own doctors? And I'll review that with Dr. Ratzistorfer when he gets on. But I think our purpose of this was just to be able to see what are the important questions to ask her. What are these questions that I could just say, hey, you know what, that's not important? Or what are the things I should be asking my provider, following up? And if I'm not heard, why is this important for me to follow up on? So really, really, really excited. I'm going to wait for the doctor to get on. But in the interim, I'm just going to look. Some of you put some great comments here as I actually set an alarm to listen, or what a brilliant idea. Thank you for this. I'm so appreciative. I haven't done a live in a really, really long time. And I'm so appreciative that so many of you responded with how important this felt for you. And, when I do a live, I want it to be something that is something that resonates, and is something that, lands well for you. So I'm really excited to see what we get done here. And obviously, we have, like I said, your good questions here to work off of. So that's what we're going to do. I just accepted their request. So we should be seeing the doctor in a moment. There you go. And amazing, we're on.
Hello, how are you?
Good, Baruch Hashem. I had a couple of people who were messaging me now of like, I set an alarm for this, or I've been waiting for this. So I'm really, really excited. I think it's been one of the more anticipated lives that I've done. The question certainly spoke to that. And I think one of the things that I just wanted to say before we start is, I had a couple of people asking me, I don't understand, why are people asking you this question? Why aren't they asking their doctor? And we'll address that. But I think just to set the tone and intention for this live, at least on my end, and I'd love to hear what you think, is we want people to understand what they should be following up, and yes, going to their doctor and really asking the question. And if in any way they don't feel heard in that situation, why it might be important for them to kind of either push back or find a different provider or something like that, because this is important. And sometimes the one thing, I'll just introduce myself and say, so first of all, my name is Sarifka Cohn. For those of you who are not on my page, you can hit the follow button. And I run an organization called Links Family for children and teens who lost a parent. And because I've been doing this for 18 years, I've gotten a whole bunch of alumni who are epic and wonderful, and people who lost a parent as children. And then when I started on Instagram, I developed just a lot of relationships with a lot of people here who either are my age and there was never the support when we were children who lost a parent, or, in any other capacity, people who just have experienced parental loss and come to this page seeking that sort of support. And so often when we did the Q&As, and I can just speak to it from my own experience, having lost my mother at the age of 9, um, I got questions about related to motherhood, related to pregnancy, related to birth, and saying, I just don't know who to ask. And I've recognized over time that it's not just the motherless ones, some of us, the fatherless ones as well. And then also just obviously we invited any parent onto here because some of these questions are just important for anyone. Dr. Ratztorfer, why don't you introduce yourself and tell us a little bit about you and the practice, and then we'll dive right into the
Sure.
questions.
Thank you so much for having me. My name is Yoni Ratzersdorfer. I've been with Maternal Resources for close to 10 years since I finished my training. We are a bit of a unique practice. I don't know how many people out there know what we are all about, but we are a small practice. We're a group of 4 physicians and a few midwives who are trying to really provide really close, careful, caring care for our patients, that we're really trying to let everyone be heard, individualized care. Yes, we're, thank God, very busy, and a lot of people want to come to us and have a lot of need for us. But the goal is that when you're sitting in front of us or with you in a delivery room, you feel that you're the only person in the world that matters. and we're hyper focused on your issues and what's going on with you, to give you that full feeling of attention, and that's really the only thing on our mind when we're speaking to you.
That's amazing. That is absolutely amazing. And I think speaking to some of the questions that were being asked, I think we'll get into that and the need for that and the need to have a physician who does listen. I'm just going to point out is that we did get a lot of questions before. We're going to prioritize those. However, there is a question box, and that's going to be easier to follow than in the comments. Although if you do put it in the comments, I'll try to notice. Certainly, if it's a follow up to something we're talking about, please feel free to comment. But do use the question box. We will try to get to as many of them as possible within the time frame that we are working with. Okay, so now we're going to dive right in um, to some of the questions. And just to give you context, I'm holding my phone, the other phone here, with some of the questions that came in. I don't remember them all by heart. So if anybody sees me looking away for a moment, I'm just like looking at what the next question should be. Um, so I think that the first question I left because it's such a fundamental question, and I know it's an opinion, and I know that not every doctor will have the same opinion, but hey, let's hear yours.
Okay.
The person who submitted this says, I was totally unprepared, as some of us motherless mothers are, for what it means to come home with a newborn.
Yeah.
And I got a similar question from somebody who said, I just totally felt unprepared for anything during my pregnancy. She said, interestingly, is that she did feel she was more prepared for how birth would go, but not anything pregnancy wise. My husband and I were both so overwhelmed, and both of us ended up having nobody to lean on. I ended up with a fever, had no clue it was an emergency. Is it on the doctor to educate the patient, or is it on the patient to educate themselves?
Very, very good question. I think that in general, in life in general, it's both ways, right? It is obviously, as a patient, as a person, you have, responsibility for yourself, certainly, first and foremost. I think that especially these kinds of situations, if your doctor doesn't know that there's that other kind of stuff going on in your life, it's going to be extra difficult. If your doctor knows, then hopefully they will be, broaching those kinds of issues and trying to help you with those things, right? If you know that a patient doesn't have a mother, who's coming with her for her birth? Who's going to be there to support her? Who's helping her with the baby? Now, obviously, not everyone has their mothers come to their births, but it's fairly common. Women talk to their mothers all the time when they're pregnant. Is this normal? Is that normal? What's delivery like? All of those things. Now, the reality is, and I tell this to all my patients having their first babies, nothing will ever prepare you for labor. Nothing will ever prepare you for having a baby at home. But I think that it's the kind of thing that when a patient communicates those kinds of things to their doctor, it's the kind of thing that doctors definitely should be, helping out with. It's a tough, one, because in the end of the day, the OB doesn't have a lot of resources to tell you, oh, call this person to help you with this, call this person to help you with that. I think pediatricians are also an excellent resource for those kinds of things. For example, a common question we get is help with breastfeeding, right? So we have lactation consultants who we use, in a lot of places, but at the same time, pediatricians will often have that kind of information. So a lot of times, pediatricians can be great resources for those kinds of things, right? You
That
have
is
you have
very
doulas, postpartum doulas, are an excellent resource as well. So there are definitely ways to avail yourself of those kinds of things.
amazing. Somebody said, and I have to bring this up because I got so many comments when I just posted the question. It was as though I had posted something like, sacrilegious. You're like, oh, what did I say here? Somebody said my labor and delivery was long, 20 plus hours. So first of all, just for you, I had people writing back. The first thing was like, that's long. Mine was 30. I'm like, okay, you know what? We're women. We're gonna go into this as a competition.
Exactly.
So it was long for 20 plus hours. And my doula said it's because I was anxious about the birth. Is that a thing? I'm now expecting my second. Any ideas?
So the first thing is, well, so to start with, second babies are nothing like first babies. So that's the first most important thing to remember. Second babies, generally speaking, assuming everything is going the way one anticipates, tend to come a lot easier than first babies do. 20 hours is a long time, certainly for someone to be sitting around in a hospital and waiting and waiting. And if you're in pain, uncomfortable, any of those kinds of things. A lot of it also depends. Is someone naturally in labor? Is someone being induced? Those situations are very different. So natural labor goes at the pace it goes. Obviously, a lot of our job is to help keep it moving, make sure things are appropriate. There's no rush to it, but you want to be certainly seeing that you're getting towards the goal line and trying to get to the accomplishment of actually delivering the baby. But second babies do tend to go a lot smoother. Anxiety definitely can become an issue. Now, Whether I can tell you that, being anxious will directly make you not progress in labor, not necessarily. There are definitely a lot of people who believe, and plenty of doulas sometimes, a patient doesn't want an epidural, for example, they're in a lot of pain, they're tense, they're not letting their body do its thing and do what it's meant to do. Can I tell you that there's a mechanism that I can explain to you that makes that, happen? Not necessarily. Labor is very tiring, obviously. Being exhausted doesn't help anybody. Um, Eating is another piece, right? A lot of people, either they're told they can't eat or drink for whatever reason. Always something important to ask your doctor whether you can eat and or drink in labor, definitely to help keep your body going. But a lot of times people are very anxious, and it definitely intense, and it definitely can hold things up. I've had plenty of situations like that where people got an epidural, then they took a nap for a couple of hours, and by the time they woke up, we were in business, ready to push and, have a baby.
Amazing. Amazing. Somebody said, is there, and I know a little bit of your thoughts on this, so I can't wait for
Okay.
everybody else to hear it. Is there a good book you recommend to expectant mothers? Or somebody else asked, is there a good course
Yeah.
you suggest? So hey, here's your soapbox to get on.
Yeah, yeah, we had spoken about this a little bit in preparation for this. I honestly don't have, any particular recommendation. I think that, like everything in life, get experience, get information, become an educated consumer. The example I always give patients, if the accountant tells me this is the money I owe the government or what the government owes me, yes, you do a little Googling, learn the terms on your tax return. But at the end of the day, if that's what they tell you, that's what it is, right? You're not an expert, just because you did a little Googling or read a book or something like that. Legal advice the same way. So I think it's good to be an educated consumer. YouTube is a good resource. Google is a good resource. Your friends, your family, anything is really a good resource. But what I always tell people, ask us afterwards. If you hear something that sounds crazy, that you're like, I definitely would never want that, or something that sounds really great, and you're like, I definitely want to do that, delayed cord clamping, or whatever, various things that people want. Most of what people want to do, we typically do anyway. Most of what people want to avoid, we generally avoid anyway. But the best advice I can give first time moms, especially, nothing will prepare you for labor. So do some research. Nothing is ultimately going to prepare you for it. Go in with an open mind. Don't go in trying to over control a situation that is ultimately not controllable. And really just go with an open mind. Don't have too many preconceived notions. Go with an open mind. Follow the lead of your doctors, follow the lead of your nurse. Having a doula is an excellent resource. I'm a big fan of doulas. That's obviously a controversial thing in the world of OB. Some people like doulas, some people don't like doulas. I'm a big
Can we
fan.
we pause on that for a second? What
Sure.
do you feel? Because that was one of the questions of like, some people, like you said, some doctors love doula, some doctors don't. Um, if you're going to have a doula in the labor room, is there a way to make it work best with your OB?
Definitely, it definitely is. I've been in some very weird situations with doulas where the doula clearly had their own agenda, and that is definitely not going to work out. A doula is there to support the patient and what the patient wants.
When
And
you
sometimes,
say her own agenda, not different from yours, but different from the
no,
patient.
correct, correct, different
Right,
from the patient's. Forget my agenda. My agenda is to safely deliver the baby.
right.
And how we go about that, in the end of the day, as long as we have a safe, healthy delivery, that's ultimately what counts. We want a good experience. So I always tell patients when I see patients, right, my number one goal, healthy mom, healthy baby, obviously. If someone is trying for vaginal delivery, our practice is all about vaginal delivery for people that know about us, but it's not always doable. There are times that it's just not going to work out for whatever reason, and that's the mazel of that pregnancy, and that's the way it goes. But I always try to tell people the experience should still be good. Even if things don't go the way you expect, you should have a good experience. Our goal is to get you through it, obviously safely, but at the same time that that everything was done for you. We've tried everything possible for you, and if we have to go to the OR, but that's not what you were wanting, but in the end of the day, that's the way it went. But everything was done, and we keep it as gentle as possible. We keep you as informed as possible. That's really what it's all about.
I think what's beautiful, I loved your line of like, even if it wasn't what you're expecting, your experience should still be a good experience. I mean, I can only speak as somebody who's had some interesting birthing experiences, and I think sometimes it's just so we do have ideas in our head of how things should
Sure.
go, and sometimes, like you said, I love your line, it's the mazel of the pregnancy, it's the mazel of the thing, right? Sometimes you just can't, there's nothing you can do about it, and at the end of the day, having, you know having the understanding that the experience itself can still be a good experience is it's a transformative thought. Somebody just wrote, "Yep, thank you, Dr. R, for delivering my healthy son even via a C-section."
In the end of the
So you know what?
day,
And
that's what
right,
counts, right?
exactly.
It's
The
all
key being the
about.
healthy child here,
Yeah.
right? In
And
terms of
even
that.
even when you run into those, thank God, very rare, but true emergencies where it does get chaotic in the labor room and a lot is going on, always trying to, stay calm with the patient, keep the patient calm, understanding what's going on. And sometimes I said to people, this is what's going on. I can't explain it right now. This is what we have to do, and but I will explain it to you afterwards. And I think people take well to that, right? And so getting back to the doula, piece of it, that having someone there with their own agenda is no good, right? So, for example, I've had situations where a patient came in not wanting an epidural, and ultimately they changed their mind. The patient said to me, "I want an epidural." So I said, "Okay, no problem." And the doula said, "No, she doesn't." And I don't feel so great about that, right? If the patient
Right,
says
right,
something, now we can discuss it. Maybe the patient's just anxious, this and that, whatever it is. But in the end of the day, if that's what the patient wants, that's what the patient wants. So
right,
when it comes to doulas, I think meeting with your doula or speaking with them, in advance is very important. Understanding, they understand what you want, you understand their methodologies. Labor coaches, doulas are all different from each other. Personality being a very, very important thing. You have to gel, with the person who's going to be sitting with you in your room for potentially a lot of hours. And that's, I think, what it's really all about. Doulas getting along with the nurses,
right.
labor and delivery nurses. Again, some are more receptive, some are less receptive. That's personalities, across the board. But there is good data
And I think
for
just
it.
to speak to that, you were mentioning something which I found fascinating is that your practice actually has some doulas that work with you.
Yeah,
Tell us a little bit about that model for a
yeah.
second.
Yeah, so we have a couple of labor coaches we work with frequently. So Raising Green is actually a part of our practice. She does a lot of office work and basically keeps the place afloat. But she does labor coaching as well for patients who want that. So she works exclusively with our patients. She speaks to people throughout their pregnancies. They know her very well by the time they're coming into labor very often. And it's just a wonderful experience. Now, the other piece that's good is for somebody who's busy with your practice in the hospital, the nurses all get to know. And so that also builds a lot of trust between nurses and the labor coaches. This is your role, this is my role. No one feels like anyone's stepping on anybody's toes, which is certainly something that can happen
Right.
sometimes. And so, really having a cohesive group is really what it's all about to support the patient ultimately.
Right. Because ultimately, if you're working as a team, then the patient is not having to play, ping pong ball with the, with the different people who are assisting, and
Absolutely,
that's amazing.
patient should be the
I
center. That's the key.
Yeah, and somebody just wrote, by the way, here is that you were really helpful to her, and that you spoke with her Rav,
Okay.
and I think that is another element that I just want to bring up here is how do you feel about a patient saying like, well, this is a big decision for me to make. Would you feel comfortable explaining this medically to my doctor, to my Rav rather, so that we can make some sort of informed decision?
Yeah.
Tell so because I
We
know that you do have a relationship with
yeah.
many Rabbanim. So tell
We,
us a
we
little
speak
bit
to
more about that.
Rabbanim. We speak to Rabbanim very frequently. Everybody has their own hashkafa in terms of, I am going to ask my rabbi about medical interventions. I'm not going to ask my rabbi about medical interventions or those sorts of things. That obviously is a hashkafic issue. Different people,
Right.
differently. Sometimes it's more that kind of stuff. Sometimes it's straight halakhic questions. Is someone nida? Is she not a nida? Can I do this on Shabbos? Do I have to do that on Shabbos? Just straight halakhic issues. Fasting is a big one. My phone rings off
Right.
the hook the week before Tisha B'av, the week before Yom Kippur, with Rabbanim calling me. Can I ask you this? Can I ask you that? What about this? What about that? It's very important because we don't work in isolation, and Rabbanim don't work in isolation, right? The same way that I'm not a Rav, and I tell people I am no Rav. Don't know the first thing about Psak. I know what I know. I know what I don't know. I know from my experience speaking to Rabbanim, different approaches and things like that I've encountered. I'll tell you from a medical standpoint how I see things. And the same way a Rav, can give a psak if they know the issue. If a Rav is giving a psak on an issue they don't understand, that's like me giving you legal advice. I'm not a lawyer. I don't know the first thing
Right.
about it. So it's very important to work together.
That's amazing. There was another question here I just wanted to see. Okay, so somebody asked that she said her sister uses you as a doctor, and she says, but I live in the Midwest, so she says I'm not so lucky.
That's not so
Which just to
far.
point out to people, where is your practice? Where can people find you if after this live they're like, okay, I finally found my doctor.
So we have four offices. One in Hackensack, that's right near the hospital. One in Farmingdale, so right near the Lakewood area. We have also Jersey City and Hoboken.
And just to clarify, like you're in some of these offices,
All
how
of the offices.
how
So
does
the
it
way that we structure our schedule, we do a lot of running, so the patients, we try not to have the patients do the running. We go to all the offices. It's definitely a complicated schedule and it changes all the time. But we try to be available in all the offices so that people can meet everybody throughout their pregnancies.
so that whoever they meet technically
Correct.
at the time of their
Anyone
birth,
could deliver you because we are a group, like I said, we're a group of four physicians and three midwives. So you could end up with anybody, with you in the hospital, really just
right?
depending on when you come in and who's on call, who's available. But everybody practices the same way, the same philosophy of how to practice, how to get people delivered safely. So we work very much that way. It's not like, oh, you're my patient and you're this one's patient, and it
Yeah,
doesn't work that way.
that's
We're a
also
group.
super important because sometimes, I know people will say, "Well, I'd love to see my doctor throughout." Yeah, but if your doctor is not on call Tuesday at 11 p.m. when you go into
Yep,
labor and nobody there has ever seen you, that could be challenging. Somebody wrote, what's the name of the practice? The name of the practice is Maternal Resources, right? I mean, I
correct.
know that's the Instagram handle, so I'm going to assume that's
Yep, that is what it
the
is.
practice name. Um, so anyway, she says she's not lucky enough. She lives in the Midwest, she says, and she did not have a good experience with her current doctor. She's looking for a new doctor. She says, are there any good tips that you have in what to look for or what to ask to ensure that you're a good fit for your OB?
So I think it comes to a few things. One issue is certainly smaller group versus larger group, right? And they both have their pros and cons. Sometimes, especially smaller groups, we cover ourselves for call almost 365 days of the year. There's very, very little time that none of us are available. Pretty much comes down to Yom Kippur. That's pretty much it, for the physicians, but pretty much every other day we are available. Some small groups cross cover with other groups, which it makes, people's lives a little bit easier from the doctor's standpoint. Some patients like that, don't care. Some people are like, nope, I want to see someone from my group. So larger groups are going to be on call more for themselves very often. But really, I think the goal is setting the stage at your first visit, sort of coming with the questions that you have, and whether they're good questions, not good questions, do you think they're silly questions? I don't think it really matters. You should ask the questions that you have and the things that are important to you, and feel out how your doctor answers you. Do they ignore you? Do they respond to you? Do they try to finish up and get out of there before you're done asking your questions?
Right.
Really important. I'd written an article in the Jewish Link, which is the Bergen County local Jewish paper. I don't know, sometime this past year. And I don't remember the exact title, but it was something along the lines of questions to ask your doctor, basically.
Oh,
So it's
wow.
easily Googleable. And the point was simply, these are sort of, I think I broke it down by trimester. Sort of, these are the things to think about in the first trimester. These are the things in the second trimester. But ultimately, don't feel stupid asking questions, because I don't assume that people know anything about pregnancy, even people who are physicians themselves or OBs themselves. I talk to them like they don't know anything about obstetrics, and this is how we do things, and this is how we think about things, and this is where we're at. So I think that's really the key thing. Do you gel personality wise with the person, with the people you're seeing? Obviously, do you think they're capable and competent and have good skills?
Hmm.
Um, is very important. And obviously, these things are not always easy to figure out. Google reviews and things like that can be helpful, but at the same time, there's plenty of people out there that have not the best Google reviews, but they're actually excellent physicians. And sometimes people's Google reviews look great, and you're like, I don't like this person. So I think really going and feeling out the situation for yourself is really
Right.
the key.
That's amazing. Um, and I love that that article's there. I'm going to have to Google it and find it. Interesting. Now we're going to get into some more specific medical questions that
Okay.
people ask. And I know obviously you can't give anything as medical advice to that person,
Right.
but more if you were in this situation, would you take this to a doctor? Would you ignore it? Would you say there's further testing needed? Like, we're just give even a mahalach.
Right.
So somebody write, my family has a history of kidney disease, and I know this came in from a couple of our alumni.
Okay.
My mother passed away 17 years ago from kidney failure. I'm a carrier. I did PGD with my first child to ensure that my child is not a carrier.
Okay.
I'm otherwise healthy. Is it dangerous for me to get pregnant again? And what would mitigate those risks?
So, with any medical complications of pregnancy, whether it's kidney disease, diabetes, lupus, it really hypertension, high blood pressure, it really doesn't matter. With any medical complication of pregnancy, kind of the way to think about it is, what is my current disease status? where am I in the spectrum? Do I have very mild disease? Am I very, very sick? So for kidney example, do I have very mild disease or am I on the transplant list? Right? Well, no, if you're on a transplant list, no one's going to recommend pregnancy
Right.
till you get transplanted, right? So what's my current disease status? What is the anticipated effect of my disease on my pregnancy? So is my disease expected to cause trouble for a pregnancy, whether it's preterm birth, whether it's a baby not growing properly, are the medicines that you have to be on and there's no choice, higher risks of birth defects, anything like that. So
Hmm.
the effect of your disease on the pregnancy. And then the flip side of that is what's the effect of pregnancy on your disease process? Is pregnancy likely to worsen a disease process? And if so, by how much? So, or is it not going to make a difference? Some diseases actually go into somewhat remission while pregnant, and so people often are better for a while afterwards. So it really depends on the details of someone's disease process, regardless of the organ system. So the keys for those kinds of situations are before anticipating a pregnancy, before considering pregnancy, seeing an OB or a maternal fetal medicine specialist, a high risk OB, for a consultation regarding that. And most importantly, or second to that is seeing whoever's managing you when you're not pregnant, seeing that person, whether it's a kidney doctor, a cardiologist, whatever it is, seeing that person to get an idea of where you're at. What is there a way to optimize anything prior to pregnancy? So, for example, if your blood pressure is too high, don't get pregnant when your blood pressure is crazy high, or if your sugar is crazy high with diabetes, try to get it under control before getting pregnant, because that, generally speaking, is going to give you better outcomes. But is pregnancy going to dramatically worsen your disease process? So, with kidneys, for example, right, pregnancy can worsen kidney function and lead to sooner time to transplant. Again, depending on the disease. So, these are things to always consider prior to pregnancy.
Wow.
And another piece also is, for example, let's say someone has high blood pressure, seeing a cardiologist to manage it. Some cardiologists have seen lots of young women and pregnant women and deal with that all the time. Some cardiologists are just seeing people in their 70s and 80s and haven't dealt with a pregnant patient in 15
Ooh,
years.
that's a good one.
And
Right.
so that's another important piece is how comfortable is the person you're seeing for whatever the issue is, how comfortable are they managing pregnancy? Whether it's psychiatry with medication safety in pregnancy, whether it's, heart, issues in pregnancy, diabetes in pregnancy, the management can change. And so seeing somebody who's comfortable with pregnancy is very important.
That is such a huge piece of advice. Just because I think that we don't like think sometimes like, is this doctor equipped to dealing with this, or is this not what they see usually? It's like going to an internist who never sees
Right.
kids and bring them a baby, right? So going straight to that, interesting that you touched on this a bit, but somebody said my blood pressure is hard to manage during all of my pregnancies. My father, Elvisham, died of a heart attack, so there is a history in the family. However, I eat well, I'm fit, and it still continues to spike with each pregnancy. Is there anything I can do?
That's a very specific question, so it's
Right.
hard to answer,
Okay.
like
In
this.
general, I'm just
In
curious for
in general,
patients
so
who,
for
yeah,
so for
for
example, right?
patients who
So
have high blood pressure
right,
during pregnancy,
right,
what's your advice to
right.
them?
So a big piece of it is pregnancy is likely going to worsen that, while pregnant. So trying to be as optimized as possible prior to pregnancy. Again, what's the disease status? Have you had an echo to see how your heart is doing if you've had long-standing high blood pressure? Pregnancy, I try to explain to people, is like a stress test on your whole body, right? Most people are young, healthy women. They don't have major medical problems or minor things. And the pregnancy, though, can unmask things that are there under the surface. So, for example, someone who has gestational diabetes is at risk of diabetes down the road as they get older. Somebody who has preeclampsia, blood pressure issues in pregnancy, even if they haven't had previously, is at risk of heart disease, kidney disease, blood pressure issues as time goes on, as you get older into your 40s, 50s, 60s, 70s, etc. So that's a big piece of it. When someone has high blood pressure going into pregnancy, trying to have it as under control as possible with pregnancy safe medications, knowing the status of your heart, how your heart's been doing in the meantime, and having an echo, having the cardiologist follow you. In terms of preeclampsia prevention, baby aspirin has become a very big thing nowadays. So starting baby aspirin early in pregnancy is generally speaking advised. Frequent close follow up. Home blood pressure monitoring can be very important. So they're really keeping an eye on where the pressures are at, on a daily basis, not just when you come to the office, but seeing people frequently. And communication is key. Whether it's the patient communicating to the OB office, or they're going to be managing it, whether it's going to be your nephrologist or your cardiologist is going to be managing it. communicating with them on a regular basis. Between the different doctors, we have plenty of times that we're on the phone with the cardiologist, the nephrologist, you know, how's this, what's that, what's your take on it, what's our take on it, and then trying to put together, where to go when you have patients who are medically very complicated.
Wow. And to speak to that, somebody actually asked, like, how do I know if I'm being annoying to my doctor and asking too many questions?
You probably are. But but that's good. That's fine. That's fine. Our job is to give people information, right? That's our goal. It's not your job as a patient and as a non-physician to be the expert on pregnancy. And so our job is to give you information. Ultimately, what you do with that information, that's up to you, right? So, you may make a decision that I think is not the best decision, or, we have different opinions on something, and that's fine. But I always say, as long as you're making an informed decision, that's what's key. So patients ask questions. I'm happy to sit there answering them, whatever it takes, as long as it takes to try to get the point, settled for them. If somebody leaves my office and they're more confused than when they walked in, or they're more anxious when they walked in, generally don't feel like I did a good job. The goal is that people will come with their questions and their problems, and they leave, with a little bit more
Feeling
yishuv hadas
empowered
that,
and
like,
educated.
yeah,
Yeah.
exactly.
And quick question for you, sort of in this piece. Some of the women were like, how much, especially for the motherless ones, how much is the history of a parent's medical history relevant, meaning say particularly mothers, I guess, their own pregnancy and birth history relevant to an expectant mother, meaning say her own
Right.
mother's birth or pregnancy history. And to add to that, what do you do if somebody was four when their mother died and has no idea of anything medically?
Yeah. Yeah. So, I mean, look, having family history is always very helpful, right? If a mom, especially if someone's lost a mother, was it pregnancy related? Was it not pregnancy related? Now, thank God it's generally not pregnancy related, because, nowadays pregnancy, thank God, usually goes totally fine from that standpoint. But sometimes it is something medical that pregnancy may have, some impact on. And there's more to it. So whatever history people know is always extremely helpful to be able to give us. And let us say to you, nah, not important. We don't need to worry about that. Rather than you assuming what we do or don't want to know, tell us and leave it. Put the responsibility on us to figure out what's relevant and what's not.
Right.
That's not your job as a patient. When someone really just doesn't know a history, it is what it is. I mean, we do the best we can in that situation. The same way that somebody can be, God forbid, in a car accident, they come to the hospital and we don't know anything about them, and they're just laying there in front of you, and you got to do the best you can, with the situation in front of you, and that it is what it is. We don't just not treat somebody because they can't tell us what's going on.
Right. Wow.
And
So to
sometimes also extended family can be helpful, right? Certainly, in the very frum world, until recently, people didn't talk about things. It's a big issue, obviously, everyone is well aware. Now, I see, at least it seems that that is getting better, and people are starting to talk more about family history and what's going on and what's gone on. So yes, do you have to tell your child when she's 10 years old, oh, by the way, everybody's had breast
right.
cancer? No, of course not. Not the time for it. But by the time you're 25, hopefully someone has told you, FYI, your grandma, all your aunts, everybody, has had breast cancer. It's something you need to be on top of. And so even if someone, has lost a mother or a father at a very early age, and so you may not know the information yet, there's probably or hopefully somebody who knows the information. And so you may have to pry it out of people, but an aunt and uncle, if your grandparents are still alive, they probably know something. If they're not alive anymore, hopefully an aunt or an uncle, somebody hopefully knows something and will be willing to share with you. And I think that oftentimes, families even that are hesitant to share information, if you explain to somebody why you need it, like, hey, I'm pregnant now, I don't know anything about what happened with my mother, this is relevant to me now, or I know maybe it was this, maybe it was that, and I'm an adult now. I need to know what's going on for my own self, or for my kids, obviously with all the genetic stuff that's out there now and all the genetics testing, which all the controversies that come with that, and complications that come with that. But I think people are starting to really understand that this stuff is important and can make a difference.
I think that this is fascinating. And I think that the part that you mentioned about explaining to somebody the purpose of it sometimes helps even those who are more reticent usually be able to come forward and be able to be more open about it.
Yeah.
Just curious because, again, when I posted this question, I got a million people saying that's such a myth, baloney, macaroni. And I had people writing, oh my gosh, this is exactly me. 100% this makes sense. So this is beautiful about the world of the internet, just in case we didn't have enough cautionary tales. This is
Yeah.
exactly why you cannot take somebody's experience and make that your medical, piece. So somebody said, I had my first two children via C-section. My mother, Lasham, also had all of her four babies via C-section. Is that a coincidence, or is that something like mother, like daughter?
Uh, Very hard question to answer. It really depends on the details. What the
Is
reasons were
there
for
is there a time
C-section.
when like people were writing, there's no way that having a C-section can have anything to do with what their mother had?
No,
Is there
there definitely can
ever?
be. Definitely can be, yeah. I mean, if nothing else, the shape and size of someone's pelvis is somewhat genetically related to genetics, and so it definitely could be. Now, sometimes people have said to me, everyone in my family had C-sections. I said, well, that's impossible, because somewhere along the way, people had vaginal deliveries for the however many years the universe has existed before C-sections were invented and made safe. So clearly, somebody had a vaginal delivery somewhere along the way. But it gets very complicated because certainly depending on when your mother was having children, whether vaginal birth after C-section was even an option that was offered or not. Again, that's something that's been trendy over time and it's gone both ways, sometimes very in favor, sometimes absolutely not an option.
And
So it
I
could
know
be
that
that
your group, at least I got this as comments,
we do a lot.
is people said is that a lot of people said I transferred to this group after I'd
Yeah.
had a C-section or two and was determined not to have another one, and that you guys managed to be some magic genies there a little bit.
Magic, but yes, we are very much about vaginal births after C-sections. Again, for the right candidate.
Right.
We know our patient population. We are aggressive about trying to make it happen if that's what a patient wants. Obviously, we never want to hurt somebody, so we're never going to intentionally put somebody at risk. But yes, that's a big thing that we do. But many doctors don't, and that's something that's trended over the decades. Whether we do, we don't. So just because your mother had four C-sections, it could be that she tried and had issues. It could be that once she had the first one, there may have not even been a labor related issue. That was it.
Right.
So it really
Right.
depends on the
That's a
story.
very good point. That's a very, very good point. Somebody actually posted a question here was, I always have a very long labor that ends up stalling, leaving me to need high dosage of Pitocin. She wrote, how can I avoid that?
Um, I can give my facetious answer of don't have babies or have a C-section. Um, Again, it really depends on the details. Certainly, whether your water's broken or not makes a big difference. If your water's not broken yet, typically you're going to need higher doses of Pitocin to try to help progress. So I personally and my group in general are big fans of, whether if your water has not yet broken, early in the process,
Try
breaking
that
water to try to help move labor
first.
along. Again, there's lots of controversy about that, but that's our approach and endorsed by the American College of OBGYN, breaking water prior to doing Pitocin, generally speaking, as the first intervention to help labor along. And some people need higher doses of Pitocin, some people don't. What I explain to patients always is there's no magic dose of Pitocin. We start low and we work our way up or down as needed because the two things that we don't know in labor are, is someone going to need a little Pitocin or a lot of Pitocin to start contracting well? And we don't know how well a baby is going to tolerate labor until we try. And so sometimes somebody is contracting very, very little and a baby is not tolerating it. And sometimes people can contract a lot and baby doesn't mind it at all. And the goal is to contract sufficiently that you make progress, not too much that the baby gets sufficiently upset that we can't do that. And so there's no magic dose of Pitocin. Some people you start them at 2, which is the usual starting dose, and they're off to the races and they deliver very quick. And some people they're not feeling anything until you're at 24, and like, okay, so it took time to get there. But it doesn't really matter to me what dose somebody's on. It's really just about watching the situation.
Amazing. Somebody said my mother died in childbirth, actually right after childbirth, and I've worked through a lot of my anxiety. My OB keeps telling me, though, is that what your mother had was a fluke. There's no need for you to worry because she's
Okay,
very anxious, obviously. She says,
sure.
but I do worry that I can also be the fluke. She said, so I'm not finding that particularly helpful. I'm wondering, is there really nothing that I can do?
Uh,
And I hear this all the time from women who've experienced any sort of parental loss during pregnancy or birth related or seemingly birth related, because sometimes we don't really know, that there's obviously naturally a lot of anxiety around that. And I guess the first thing I would just say is I just want to normalize that you're not crazy. Like having that
you're not
level of
crazy.
anxiety. No,
No,
sometimes,
for sure.
no, sometimes you say to somebody like, okay, that level of anxiety, like as a friend, not as a professional, as a friend, they'll sometimes like say like, okay, that's like a level of unnecessary
Yeah,
anxiety. Stop it. This is kind of the necessary anxiety in the sense of your body and your mind are protecting yourself from what you see as a very scary situation.
sure,
But I'm
sure.
curious how you would answer to that.
So I think I think it depends. Obviously the specifics are key, in a situation like that, whether, other doctors would agree, not agree, whether it was a fluke, not a fluke. Again, I don't know the details of the situation. But yes, it's very possible that it's a total fluke and there's no reason to really be worried. But that's the way the human mind is. Humans are not rational. Humans are very emotional thinkers. And so while we can tell you, yes, the statistics are blah, 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 and they're in your favor and all of that, and that's so unlikely to you, that's the only thing you know. For your family, it happened 100% of the time. And so, for you as an individual, it's 0 or 100. And so for you, it's what happened. So trying to reassure people with numbers can be helpful. I think validating for people that these are the numbers, and I know you're not hearing anything I'm saying, but we're going to keep talking about it and keep going through it, I think can be really helpful. Because that way people have time to sort of absorb it, as the pregnancy goes. I think certainly if we're in a situation where really it's the anxiety is a big issue, whether someone needs to see a therapist or whatever it is, and really have that professional piece of things, I'm a big fan of. So it really, I think, depends. And then the other thing that we do, or the way that I do things, when someone has had some sort of a bad loss, situation, whether it was some a family loss like this, whether somebody lost a pregnancy or a very little baby, is I really try to explain to people we will follow your lead on these kinds of things. So some people, for example, if they've lost a baby or if you lost a mother to a pregnancy-related issue, they might say, you know what, I understand it won't make any difference how many times I'm in the office, but I feel better coming in every week or two. Like, okay, so come in every week or two. I don't care. And some people say, oh no, I get way too anxious coming in. What's the bare minimum I have to be here? Obviously I'm not going to be irresponsible. What's the bare minimum I have to be here? And I'll come when you tell me I absolutely have to. And other than that, I don't want to be in here because it makes me too anxious, and I'll follow people's lead. And I've had patients who have had, crazy, histories, and they've come literally almost every week from the time they knew they were pregnant until they delivered. And we've seen them, like 36 times. And for some people, that's what they need.
That's beautiful. And I love how you're saying is like there are some that are this way and some that are that way, because kind of like everything in grief, there's no
And
one
there's no
size
right
fits
way.
all. Right?
Yeah,
There's
no
no one
right
size
way.
fits all.
So everybody
And
perceives these things
meeting
differently.
them where they're at is a huge piece. I just want to say that that's kind of one of the questions that, we had spoken a little bit about this one. And I think part of what made me a fan, if you will, of the practice and of your work is the idea of there isn't one size fits all. There really
Right.
isn't, and for every patient, it's going to mean something completely different. So, just speaking to those people here, because I see a couple of you wrote me too. Um, I think for some of you here who've had this sort of experience in any capacity, this is what you're going to need. You're going to need someone who will meet you where you're at and be able to be accommodating. Question, my again, we're going through a few of the medical ones, and then we'll go back to some of the general ones. My
Okay.
mother died of ovarian cancer at 45, which is considered early.
Okay.
I tested negative for BRCA, which is the genetic testing for breast and ovarian cancer, for those who are not familiar. Is there anything I need to know about pregnancy or birth control?
Oh, that's a very tough one. So first of all, when it comes to genetic testing, definitely see a genetic counselor. That's the most important thing because things have moved now beyond just BRCA testing. There are now many genes that are being tested for various things. So that's number one. Is always, see a genetic counselor. Whether you can use various birth controls with estrogen or progesterone in the setting of BRCA, or in the setting of these, high risk situations, there's a lot of controversy. So it really is the kind of you have to speak to your doctor and how do you perceive numbers, because sometimes some of the data, for example with breast cancer, it's like there was an increase in breast cancer cases, of 2 in 10,000 population. I mean, yes, that's an increase, but it's 2 in 10,000 people. So, how do you view that? So those are really difficult questions that genetic counseling, oncology can be very helpful, with guiding you in terms of the real specifics. Cancer now also, right, again, depending on when this occurred, the cancer care and cancer genetics now is very different from what it was 10 years ago or even 5 years ago. And certainly if it's been longer than that. And so everything's getting much more molecular now and not just it was ovarian cancer. But now it's what type was it, right? In breast cancer, the same way. It's not just breast cancer. What are your hormone receptors and all of those things that have gotten way more complicated nowadays? So it really is a long conversation.
Wow. And is there anything that you think pregnancy wise people should know in terms of having the ovarian or breast cancer gene in the family, or is it
So
just on the birth control
yeah,
piece?
no. So pregnancy-wise, also it becomes relevant. So obviously, screening is very important. Breast cancer is the most commonly diagnosed cancer around pregnancy, which kind of makes sense. It's women and young women, and obviously it's a cancer that can, can be an issue. So certainly if somebody feels a lump, anything like that, obviously around pregnancy, bring it up. It could be totally normal, but obviously always something important to bring up. The other question that becomes very difficult sometimes is at what age, do people then feel undue pressure to have babies very young and then stop having babies at a relatively younger age and to have surgery, if they're, BRCA positive, for example. So that's, again, a very difficult, decision that a family has to make. And that's, sort of what we were touching on before. No, you don't have to tell your daughter when she's 10, like, hey, by the way, we've got this gene in the family. But, it's become very controversial. When do you tell your kids? Are people going to feel like they're being unduly pressured to have kids early? Or sort of let it ride and, leave it be. Screening is very, very important. And so, timing screening, you can have some screening during pregnancy, screening in between pregnancies, and certainly if you're trying to get in a bunch of pregnancies in relatively short order, getting screened, in between pregnancies. If there's a family history, see oncology, relatively young, see genetic counseling relatively young, so you can really get plugged in with what is the most appropriate, follow-up management for you during and between pregnancies.
Wow. Wow. This is such important information. Um, Somebody asked about postpartum anxiety. How do you screen for that after pregnancy, after birth?
So a lot of hospitals now are doing the various questionnaires, that are out there. A lot of offices are doing questionnaires when you come for postpartum visits. Again, I think it really comes down to communication. Patients should be coming in for postpartum visits. There are plenty of people who are like, "Oh, I'm busy. I don't want to come in." That's obviously,
No, just
not a great
don't,
approach.
guys.
Yeah,
Guys, just
not a
don't.
great approach. Always good to come in. I think also talking to husbands or partners, can be extremely helpful in that, way, because a lot of times people don't necessarily have insight, themselves. We get a lot of calls from husbands or from partners, saying, I need to talk to you about my wife. I don't know that this is normal. I think that if a doctor tells you, oh, it's just the baby blues, then it's totally fine. But if you don't feel like it's fine, you need to pursue it. Because a lot of times, people may write things off, and you really need to pursue it. It can be really important. It really does happen. Some of it is normal. There's definitely normal depression, normal anxiety, a little bit that happens. After having a baby, you're exhausted, and all the things that everyone knows who's had kids. But definitely postpartum visits are a very important time for it. And again, keeping that open communication with your doctor. A lot of the hospitals now are sending people home with information about it. In the packets that they give you, read it, look at it. Are you having the symptoms? And reach out if you feel like you need help.
That was great. And somebody asked, related to that, actually, somebody just posted this, is that if I've previously struggled with mild anxiety and depression, okay, I'm in therapy, no meds. Is there any reason for me to share this with my OB?
Oh, absolutely.
Okay, so
Absolutely.
speak to that, because I
Yes.
think there is a confusion out there of like sort of the separation of like mental health and physical health, and I think that there's a confusion
Oh,
about this.
yeah.
So talk to us.
It is essential, because pregnancy can, especially if it's a first pregnancy and you haven't been through this before, can be a major anxiety provoking, situation, a major depression anxiety, situation. It can definitely bring on depression. And the postpartum period is key. It is very common, unfortunately, but it's very common for people to get worse after they've delivered. And so sometimes being proactive is really the key. Sometimes you'll start people on medications, whether right after delivery, sometimes, in the latter part of pregnancy in anticipation of delivery will sometimes get done. Again, therapists who are experienced around, pregnancy issues are very, very helpful. Again, just like we talked about, with medical doctors, not all therapists deal with pregnancy related issues, frequently. And so that
Yes.
could also be a big thing. And so having somebody who deals with pregnancy, or if you're seeing a therapist and it's not really working, or they've been great, but now you start bringing up pregnancy related issues and they're like, I don't know what you're talking about. Finding a new therapist can be, very, very helpful. But I think it's very important to bring it up to the OB, because it's pregnancy and the postpartum period can be a major, major issue for people, even if they've had only mild symptoms, till now.
And I think that, like going back, sort of circling back to one of the first things you were saying about the fact that your doctor only knows what you share, like you're not a mind reader.
Right.
If you're not going to feed the doctor with a little bit of this information, they won't even know to be looking out for it. And it's not so much that they're missing the signs, they just never knew that they should be looking for it in a patient
Right.
like
And
yourself.
and you can have somebody, for example, who's in treatment, they're in therapy, let's say, and so they're managing very well, right? And so there's nothing that's obvious about it. And
Right.
if you ask, and you ask people, obviously if people deny things, we can't help them. We can't, like I said, you can't read people's minds. So we can't, we can't know things if you deny them. And if you don't tell us, then, it may, something might feel funny to us about a situation. We're like, this doesn't totally add
Right.
up. Something seems off. Hopefully doctors are asking, if something seems off to them. But, they may not ask, they may not, want to ask, they may not be comfortable asking, whatever it is. But yeah, I think, giving us more information is always better. Because like I said earlier, let us be the ones who
I
decide
think that
that something's not
that
important.
part is such an important piece of like ask because let the doctor be the one to decide that this is or isn't something that is critical or important
Yeah.
for you.
I always tell patients, call us for anything. If you have a concern, an anxiety, whatever, you should not worry. We are very good at worrying for the hundreds of people that we're taking care of all the time. We're good at worrying. We're professional worriers. It's our job, but you shouldn't worry about things. There's no way you're supposed to know the
Right.
answer. Let
Right.
us do the worrying, and let us tell you, don't worry about something, rather than you just guessing.
Right. Somebody asked, by the way, what's PGD? So PGD is pre-implantation genetic something.
Testing
What is it?
diagnosis, yeah, there's different
Diagnosis.
apps we
And
use. The
that
testing
it's
is all a little
basically
bit
it's part of the
different.
IVF process where
Yes,
they're able to pre-screen embryos for
correct,
genetic for certain particular genes, and
correct.
so that if somebody knows they're a carrier, then sometimes they can prevent that from
Exactly.
being
If you know
carried
you're a
by the
carrier
patient.
of a gene, you can potentially screen it out, from babies. Now, obviously, no testing is perfect.
Right.
Nothing, nothing's perfect. Things can slip through. But yes, it's become a wonderful technology. And so, now you have couples who are carriers for various diseases and they can have kids, themselves. And, so it's very important. And doing, carrier screening is very important,
Yeah.
whether it's during charting
Yeah.
or the
That's
bigger
something.
patterns that are out there is very important.
And what's interesting for me is a few of the people who message me who are your patients seem to be your patients post IVF.
Okay.
Speak to that in terms of, anybody with any sort of anxiety or any sort of looking for something. Why would they come to your practice like post IVF?
A lot of people, when they've gone through IVF, it's a big production, right? For anyone that's never had to go through it, really thank God that you've not had to go through it. It is a big production. It's not an easy process for people. It's a lot. It's a lot of, obviously, potentially a lot of money, but a lot of time, a lot of investment, a lot of work. It's not easy. And there's a lot of hand holding that goes through that process. You're in the office all the time. You're having blood drawn all the time. You're having ultrasounds done all the time. It's a lot. It's very labor intensive. And I think that after that process and going through that, sometimes people really do have very high risk pregnancies because whatever was leading to their infertility or whatever really is problematic. A lot of times people, I think, need that extra hand holding, that not just being a number in some huge practice where you wait for 2 hours in the waiting room, but really having that extra hand holding. The other thing that we have in our practice is that everybody in the practice from top to bottom knows what's going on, knows what's going on with the patients, our stenographers, our medical assistants, like everybody knows, everybody.
Wow.
And so we really try to be on top of that sort of from top to bottom. And that's, I think, a piece
That's
that
huge.
gives people a lot of comfort.
That
Yeah,
is huge because I think that, sometimes you have a great doctor and you'll hear and you'll even read the reviews online. It's sometimes funny, but it's like great doctor just put up with the rest of the staff.
right.
And
Yeah.
if
No,
you
that's
if you
not
have a
acceptable.
staff that's inclusive and able to kind of be part of your mission and how you want to run the practice, that's huge because that
Yeah.
means the patient's being serviced on so many different levels in so many different
Yeah. Yeah.
ways.
No, it can't be, oh, I didn't like the front desk lady or, whatever it is. Like, it's got to be top to bottom that you feel like you can talk to us. If you have a question, you don't want to ask the doctor and you ask it to the medical assistant because they're just more comfortable or whatever, they'll bring it to us and they'll say, you should probably discuss it with the doctor or whatever, and so it's really
And
a
that's also great
piece.
because they're connecting like with the patients on a different level. So sometimes
Yeah.
if they're able to understand or at least know what they bring to the table is
Yeah.
something
So
super
all the
duper
time,
important.
our stenographers or our medical assistants, will, say, hey, you may want to like talk to this person about, such and such
Right?
issue because they just mentioned it to me and something seems off about it. And,
100%. Okay. There's so much gold in everything you've said. I can't even tell you. I have so many takeaways here. I think one of the greatest takeaways, honestly, is that you want to get yourself a doctor who actually has answers to your questions. And I feel like I tried to play stump you tonight. It didn't work very well. So that's great. And that was super helpful for me. And I think that just I could say this as as somebody who's been a patient, is that you want to have a certain amount of confidence in I think the anxiety comes when there's a lack of confidence. And I think that when you do have confidence, obviously Hashem is in charge and there's no outcome. Like you said, I'm going to use this line is that it may not go as you expected, but the experience still has to be good. I think all of that is key, but you want to also, and I want to empower every woman who's listening, you want to have confidence in the practitioner that you're using, in the doctor that you're using.
Absolutely.
And if your gut is saying, I don't know, then that's not a good
Yeah.
fit for
And
you.
there's a
Even if
reason.
everybody says that's the best doctor, and I always say this to people about therapy, but I'm going to say the same thing about doctors. It just might not be the best doctor for you.
Exactly.
Like, finish that sentence,
100%.
in terms of that. So that was my biggest takeaway. Curious for you if you had like your minute of, telling people like everything you wish every woman who's, either pregnant or just giving birth and is looking for a doctor and stuff like that. What do you wish they would
Yeah.
know?
I think the key thing really is communication, bringing to the table, your issues, your concerns, and really finding someone that will listen to you. I always tell people, I can't promise you an outcome, right? And so, for example, you go back to like vaginal births after C-section, because we do a lot of that. And people are really like, I must VBAC. It's like, well, no, you don't must VBAC. You must have a healthy pregnancy. God willing, we're going to VBAC, right? And we explain to people from the first visit, this is our philosophy of how to try to accomplish that. We have a thought process, keeping babies from being really big, keeping babies smaller, getting delivered in a timely fashion, not necessarily waiting until you're 42 weeks, etc. We have a philosophy. But how is that going to go for each individual person? We'll see, right? Time will tell. What are the situations going to be at the end of your particular pregnancy? And whether we're going to do A for you or B for you, I don't know at the beginning. Time will tell. And so I think it's about having a clear picture and a philosophy that is the key thing. And I think that just having that confidence and having somebody that you feel like you can trust is the key. And like I said earlier, like we can't promise outcomes, but I tell people you will know we did everything possible for you. And so if we have to veer off and take a different route because that's just the way things are going, you will understand that we did everything for you. Unfortunately, I see patients all the time, let's say, why'd you have a C-section? I don't really know. They said it was this, they said it was that.
Mm-hmm.
And I'm like, that doesn't add up, right? And sometimes it does add up, but sometimes it really doesn't. And the picture is so unclear. And what I always try to tell people is you should understand what's going on from top to bottom. And if you don't understand what's going on, that's not okay.
Right. Oh, that's amazing. That is amazing. I just want to say quickly to the people who are coming from my page is that I think having content like this online on social media is something that is so beautiful. And I know that when I started following your page, and all of a sudden I was like, there is an OB on Instagram who is actually answering real
Yep.
questions and giving real information. And it was intriguing to me. And that's why I'm so grateful that we were able to have this live together. But I really encourage any woman who, even if you don't live in that neighborhood, even if you just want to get to know a little bit more about yourself, what's normal, what's not, and understand the pregnancy and birth process, definitely follow the maternal resources page. It's been a resource for me. I think it'll be a resource for many of you. I think in addition, by the way, the way you can do it, somebody just asked, how can I do it right now? You go to the top where the live is, just where you see that little pink button that says live, and you hit the down arrow. This will only work when you're on live. So if you're watching the recording, you just go and hit their page. But there's a little down arrow, and you will see both of the people who are hosting the live. You can hit follow to whichever page you're not following yet. And yeah, I really hope that people will gain tremendous amount from the education, whether they live in the neighborhood and are able and lucky enough to be your patient, or whether at the end of the day they're anywhere, but they will just be able to have information from a real expert, not just Dr. Google.
Dr.
Um, kind of
Google is
my
very
pet peeve.
helpful. Very
Dr.
helpful.
Google's helpful. We discussed Dr. Google's
But right.
limitations, and Dr. Google's
But
has
then
a lot
verified.
of beautiful fear mongering or a bunch of banana splitting ideas.
Yep.
And if any of you are on here from the maternal resources page and you're looking to learn more about anything grief related, or looking to just become a more compassionate person within the community with anything grief related, my page is right here and you can follow it. And this has been just the most magnificent opportunity
It's
for me.
been
So,
wonderful.
so, so grateful. And Emerita Shem, hopefully we will be able to do some more follow-up work together. But this
Wonderful.
is this is just amazing. And I'm so grateful that I know it's like at night after a full day. So thank you for giving us your time
Thank you
and
so
keep
much.
keep having beautiful births, Beth Hashem, for many, many more women.
Amen. Thank Thank
Take
you. Reach
care.
out with any issues
Uh,
whenever we can help.
Amazing. Take care.
Take care. Bye
Bye.
bye.